Yeah, I started getting sick in 2005, and I was just, I ended up with mono for the third or fourth time in a row. I was so fatigued I couldn't go back to work. They took out my gallbladder a month later, and then 3 months later they took out my tonsils, and they just kept saying, well, you've got chronic fatigue syndrome and irritable bowel syndrome and all kinds of other syndromes, but nobody could really tell me why. I think I went through 6 different antidepressants because of if you have irritable bowel and chronic fatigue, they like to give you antidepressants because they think that'll help with the problem. And those things just made it significantly worse. And so I'd take it for a couple of days and I would feel horrible, so I'd stop taking it and they'd try a different one 3 weeks later or whatever it was. And it was like, well, I've been through, by that point I'd already probably seen almost 30 doctors in different specialties and in different places, and nobody could come up with an answer as to why I was so tired and why was I always getting an infection and all that other stuff. I mean, one doctor just said you might want to look at convalescent nursing care and have that be, it's a place for you to live because you're gonna have trouble with fatigue for the rest of your life. Um, so I came in a little skeptical and not really sure what to think, but I remember feeling immediately comfortable, like, okay, whatever happens, I know that she's going to tell me the truth, but she was pretty sure she could help, and I thought, well, let's give it a shot. So we did. You know, she, they were very like, here's our suggestions for diet, organic foods, grass-fed meats, healthy fats, stuff like that. Most of which, most people just sit there and go, huh. My entire diet switched overnight just because that's what she said to do, and I figured this isn't going to work if I don't at least try what she says to do. I mean, if she says change your diet, change your diet. I didn't have to take out a lot of wheat at first, but it was, dairy and some of that other stuff with, there was some specific diet restrictions, and then there was the supplements, which I seriously can't remember what they were anymore, but she did put me on some cortisol to kind of help balance out my adrenals and some other things. So it was kind of a big step. I mean, I wasn't quite sure what was going to happen, but we did it. I don't notice it.
Really?
I mean, I don't need any more cortisol. I haven't been on that since November. Most of the other medication that she had to put me on, she's been able to take me off of. The supplements are, there was a point where I was taking 48 different supplements. I'm taking 6 now. I mean, so I don't have any of that stuff. I was at the gym before I came here. I mean, I did an hour of cardio, so here, like it does actually make medical sense when you actually sit down and think about it, and not let yourself be clouded with all of the conventional medicine that you might have learned or the conventional stuff you might have learned before, because most of that stuff is really like, what's your symptom? Here's a prescription. This is more like, okay, well, your symptom is there because something is wrong. How do we make sure that your body has what it needs to correct what's wrong so the symptom at some point goes away? It's a completely different look on medicine. I mean, it's not what most Americans, I think, are used to. It's certainly not what I was used to. I just expected somebody would give me a pill and I'd probably feel better. And when I got here and there were a whole bunch of supplements and stuff like that, I really wasn't sure what to make of that. But I thought, well, I felt like I could trust Dr. Ryan, so I'm just like, I'm going to give it a shot. We're going to see what happens and take it from there. So.